Hello, and welcome. Today we're going to talk about polymyalgia rheumatica, often shortened to PMR. If you've never heard of PMR before, you're certainly not alone. Although it's one of the more common inflammatory conditions affecting older adults, many people haven't heard of it until they're diagnosed. PMR can cause severe pain and stiffness that can make simple everyday tasks feel almost impossible. The good news is that it is usually very treatable, and most people improve dramatically once treatment begins. In this video we'll cover what PMR is, who gets it, the symptoms to look out for, how it's diagnosed, how it's treated, possible complications, lifestyle advice, what the long-term outlook is. Let's begin. Polymyalgia rheumatica is an inflammatory disease. Let's break down the name. Poly means many. Myalgia means muscle pain. Rheumatica refers to inflammation affecting the muscles and joints. Despite the name, PMR isn't actually a disease of the muscles themselves. Instead, the inflammation occurs in the tissues surrounding the joints, particularly structures called bursae and tendons. This inflammation causes pain, stiffness, and reduced movement. The areas most commonly affected are both shoulders, neck, upper arms, hips, buttocks, thighs. The stiffness is often far worse than the pain itself. Many people describe feeling as though they've aged decades overnight. PMR almost always affects people over the age of 50. The average age at diagnosis is around 70 years. It is uncommon before the age of 50. Women are affected about 2 to 3 times more often than men. PMR is also more common in people of Northern European ancestry. Researchers don't know exactly what causes PMR. It's thought to involve a combination of changes in the immune system, genetic factors, environmental triggers. Some infections have been investigated as possible triggers, but no single cause has been identified. The symptoms often begin surprisingly quickly. Some people remember the exact day they became unwell. Others develop symptoms gradually over several weeks. The classic symptoms include shoulder pain. Nearly everyone with PMR develops pain in both shoulders. It may become difficult to brush your hair, reach into cupboards, fasten a bra, put on a coat, lift shopping bags. Simple movements become challenging. Hip pain. Pain commonly develops in the hips and upper thighs. Many people struggle to stand from a chair, get out of bed, walk upstairs, get into a car. Morning stiffness. This is perhaps the hallmark symptom. The stiffness usually lasts longer than 45 minutes. In many people it lasts several hours. Patients often say, "I feel completely frozen." After moving around for a while, the stiffness gradually improves. However, sitting still for long periods often causes it to return. PMR affects the whole body. Many people feel exhausted, weak, lacking energy. This isn't ordinary tiredness. It can be overwhelming, feeling generally unwell. Some people experience low-grade fever, loss of appetite, weight loss, night sweats, general malaise. These symptoms reflect inflammation throughout the body. Why does PMR happen? Normally, the immune system protects us against infections. In PMR, the immune system becomes overactive and mistakenly creates inflammation in healthy tissues. Scientists still don't fully understand why this happens. Importantly, PMR is not contagious, not caused by exercise, not caused by anything the patient has done. How is PMR diagnosed? There isn't one single blood test that proves someone has PMR. Doctors make the diagnosis using several pieces of information. Medical history. Your doctor will ask about where the pain is, how long you've had it. Morning stiffness. Whether both shoulders are affected, how your symptoms affect daily life. Physical examination. They'll assess shoulder movement, hip movement, muscle strength, joint swelling, tenderness. Interestingly, muscle strength is usually normal. People can't move because it hurts, not because the muscles are weak. Blood tests. Blood tests usually show inflammation. The two most common are ESR, erythrocyte sedimentation rate, CRP, C-reactive protein. These markers are often raised. However, it's important to know that some people with PMR have normal inflammatory markers, so doctors consider the whole clinical picture rather than relying on blood tests alone. Other blood tests help exclude conditions such as rheumatoid arthritis, thyroid disease, infection, or muscle disorders. Imaging. Sometimes ultrasound or MRI scans show inflammation around the shoulders or hips. These aren't always needed but can support the diagnosis. Conditions that can look similar. PMR isn't the only condition that causes pain and stiffness. Doctors also consider rheumatoid arthritis, osteoarthritis, fibromyalgia, inflammatory muscle disease, thyroid disorders, vitamin D deficiency, certain infections, some cancers. This is why careful assessment is important. Treatment. The main treatment is prednisolone, a corticosteroid. One fascinating feature of PMR is how quickly patients often improve. Many people experience significant relief within 24 to 72 hours. This dramatic response helps support the diagnosis, although improvement with steroids alone doesn't prove it. The starting dose varies depending on the individual, and your clinician will tailor treatment to your needs. Treatment is then reduced gradually over many months, often lasting 1 to 2 years. Some people require treatment for longer if symptoms flare when the dose is lowered. Steroid side effects. Steroids are extremely effective but can cause side effects, especially with long-term use. These include weight gain, higher blood sugar, raised blood pressure, mood changes, difficulty sleeping, thinning of the bones. This is called osteoporosis. Easy bruising, increased risk of infections. Because of these risks, clinicians aim to use the lowest effective dose and reduce it gradually as symptoms remain controlled. To help protect bone health, some people are advised to take calcium and vitamin D supplements, and others may be offered medication to reduce the risk of osteoporosis. Giant cell arteritis. This is an important related condition. Around 1 in 5 people with PMR may develop a related condition called giant cell arteritis, GCA. And around half of people with GCA have symptoms of PMR. GCA is inflammation of medium and large arteries, especially those around the temples. It is a medical emergency because it can reduce blood flow to the eye and lead to permanent vision loss if not treated promptly. Seek urgent medical attention if you develop a new, severe headache, particularly around the temples. Scalp tenderness, such as pain when brushing your hair. Jaw pain while chewing, called jaw claudication. Double vision, blurred vision, or sudden loss of vision. Unexplained fever with PMR symptoms. These symptoms require same-day medical assessment, and treatment with high-dose steroids is often started immediately, while further tests are arranged. Living with PMR. Medication is only one part of managing PMR. Many people benefit from regular gentle exercise, walking, swimming, stretching, simple strengthening exercises. Keeping active helps reduce stiffness and maintain muscle strength, but activities should be increased gradually and within your comfort level. Eating a balanced diet, maintaining a healthy weight, getting enough sleep, and avoiding smoking all support overall health during treatment. What is the outlook? The outlook for most people with PMR is good. Many people regain their normal activities once treatment starts. However, recovery isn't always straightforward. Some people experience flare-ups when steroid doses are reduced. These relapses are common and don't necessarily mean anything has gone wrong. They usually require review and adjustment of treatment by your healthcare team. Regular follow-up appointments and blood tests help guide treatment and monitor for side effects. Final thoughts. Polymyalgia rheumatica can have a major impact on daily life, but it's one of the inflammatory conditions that often responds remarkably well to treatment. If you're over 50 and develop persistent pain and stiffness in both shoulders or hips, especially if mornings are the worst, it's worth speaking to a healthcare professional. Early diagnosis and appropriate treatment can make a significant difference to symptoms, quality of life, and reducing the risk of complications, such as giant cell arteritis. Thank you for watching. If you found this explanation helpful, feel free to share it with others who may benefit, and speak to your healthcare team if you have questions about your own symptoms or treatment. If you have any questions about polymyalgia rheumatica or any other type of arthritis, please leave a comment below. I read as many as I can. If you found this video helpful, please subscribe and click the notification bell so you don't miss future videos. Every like, comment, and subscription helps this channel reach more people living with arthritis who may need support and reliable information. Thank you for being here.